Good afternoon. Happy Tuesday. It is STI Awareness Month. So today I will be speaking about STIs and STDs in the LGBTQ plus community. Let me go ahead and get this comment. I'm going to have to figure out another way to start pinning this comment up here because I'm having to manually type it, and I think it's a better way to do it. It's going to be, kind of interesting. I want to start thinking of some topics as well to kind of be more interactive with my audience. So I'm trying to think of some ways that I can do that. If anybody has any type of recommendations, please let me know. It would be very helpful. And I did switch the time of the live to now because I just think that people at 1 o'clock, people are probably at work or whatnot, so I don't want to post. Okay. All right, cool. Hope everybody's doing great. I'm doing pretty good myself. Just working as usual. I'm just waiting for my colleague to come on in and we will get everything started. It's a beautiful day here in Washington, D.C., so that's always a plus. I hope everybody gets out and enjoy the day. I definitely plan on going outside after I'm finished this. Yeah, we definitely have to figure out some other interactive lives. Some topics that because I don't want it to always be just me on here talking to everybody. I want y'all to be able to interact. Like I want you to get up here and be able to express how you feel about some of the topics and things like that. Like I don't want it always just to be me like, oh, yada yada, rambling along. I think interaction with the community matters as well in the long run. Okay, I'm just waiting for Whitman-Walker to arrive and we will begin. 1 second, everybody. I'm sorry. My colleagues are running a little bit late. Well, whoever's watching, how's your day going? Like, let's just start there. How's everyone's day? Like, okay, Whitman-Walker is here. Yeah, like, isn't that's definitely the truth. Like, like work, like um, everybody always. That's the main thing. It's like once they're off work, it's good. Like I'm doing really, really good. To be honest, like I can't complain at all. It feels great outside, so I understand getting off work. I hope everybody, gets to get outside and enjoy some of this. I hope it feels just as good as wherever you're at as it feels here. Okay, so let's get started. Okay, so it is STI Awareness Month. Um, and hello again, my name is Corey Haskett, and I use he, him, his pronouns. Um, During the past few weeks, Whitman-Walker Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. Everybody that's coming in, thank you for tuning in. Today I will be discussing STIs and STDs in the LGBTQ plus community, or just in the community in general. But I will be covering like various STIs and STDs that affect um, gay and bisexual men at a higher rate. So sexually transmitted diseases have been rising among gay and bisexual men, especially when it comes to syphilis since 2014. Gay and bisexual men accounted for 83% of the primary and secondary syphilis counts in the United States. Gay and bisexual men and other people who have sex with men often get other STDs, including chlamydia, gonorrhea infections. HPV, which is one of the most common STDs in the United States, is also a concern for HIV. I mean, for gay and bisexual and other men who have sex with men and MSMs. Um, some types of HPV can cause genital and anal warts and can lead to development of anal and oral cancers. Gay and bisexual men and other men who have sex with men are 17 times more likely to get anal cancer than heterosexual men. Men who are HIV positive are even more likely than those who do not have HIV to get anal cancer. So STDs. STDs are infections that spread from one person to another during vaginal, front hole, or front hole, anal, and oral sex. These are really common, and a lot of people who have them don't have any symptoms. Without treatment, STDs can lead to serious health problems, but the good news is that getting tested is no big deal, and most STDs are easily treated. But the possibility of the infections and disease are as much part of sex as fun. Both men and women get them, even if you didn't realize it. Even if you didn't realize it, you probably have had an STD. Knowledge is power, and when it comes to sexual health, recognizing the symptoms is a start. But you won't always notice chlamydia, gonorrhea, herpes, or other STDs. You'll need to get tested to protect yourself, your partner, and fortunately, all of these common STDs can be treated, and most can be cured. HPV. Nearly every sexually active person will have HPV at some point in their life. It is the most common sexually transmitted infection in the United States. More than 40% of HPV can be spread. More than 40 types of HPV can be spread sexually. You can get them through vaginal or front hole, anal or oral sex. You can get them by skin to skin contact too. Most types of HPV have no symptoms and cause no harm, and your body naturally gets rid of them. But some of these cause genital warts, other infections in the mouth and throat. Still, others can cause cancers of the cervix, penis, mouth, or the throat. 3 vaccines. Cervix, Gardasil, and Gardasil 9 protects against these cancers. Gardasil and Gardasil 9 also protects against genital warts, vaginal cancer, and anal cancer. The CDC recommends young women and men ages 11 through 26 to get vaccinated for HPV. The HPV vaccine is also approved for women and men up to age of 45. Talk to your doctor to see if it's right for you. A pap smear can show most cervical cancers caused by HPV early on. Chlamydia. Chlamydia is the most common reported STD in the United States. It spreads mostly by vaginal or anal sex, but you can get them through oral sex too. Sometimes you'll notice an odd discharge from your vagina or penis, or pain or burning when you pee. But only 25% of women and 50% of men get symptoms. Chlamydia is by bacteria, so it's treated with antibiotics. After you're treated, you should get retested in 1 to 3 months, even if your partner has been treated. Check with your doctor about when to get tested again to make sure that the infection is gone. Gonorrhea. Gonorrhea is another common bacterial STD. People often get it with chlamydia, and the symptoms are similar. Unusual discharge from the vagina or penis, or pain or burning when you pee. Most men with gonorrhea get symptoms, but about 20%. Most men with gonorrhea get symptoms, but only about 20% of women do. So anyone that's assigned sex at birth as a female, about only 20% of you all will get symptoms. So that's a very low number for an STD. Gonorrhea is usually treated with antibiotics. Syphilis. This is one that I was telling you in the beginning of the live, that a lot of gay and bisexual men, so a lot of gay and bisexual men in the LGBTQ plus community account for 83% in 2014. This is a kind of old data because we are a few years past that, but in 2014, 83% of first and second stages of syphilis were gay and bisexual men. So this affects the LGBT community at a higher rate. Syphilis is a tricky disease with 4 stages. In the primary stage, the main stage is a sore. Sometimes syphilis is called the great imitator because of the sore can look like a cut and ingrown hair, and it can look like an ingrown hair or a harmless bump. The second stage starts with a rash on your body, followed by sores in your mouth, vagina, and or anus. Symptoms usually appear in the third and latent stage. This stage can last for 4 years or the rest of your life. Only about 15% of people with untreated syphilis will develop the final stage. In the late stage, it causes organ and nerve damage, and it can also cause problems in your brain. Your doctor can give you antibiotics to treat syphilis. The earlier treatment starts, the fewer antibiotics you'll need, and the more quickly they work. Herpes. Both strands of herpes virus, HSV1 and HSV2, can cause genital herpes. But usually the culprit is HSV2. The main symptom of herpes is painful blisters around the penis, vagina, or anus, but you also get blisters inside of your vagina or anus where you can't see or feel them. Not everyone who has herpes get blisters. Herpes is easy to catch. All it takes is skin-to-skin contact, including the areas where condoms don't cover. You're most contagious when you have blisters, but you don't need them to pass the virus along. But herpes is a virus. You can't cure it, but you can take medication to manage it. Trichomoniasis. More women than men get trichomoniasis, which is caused by a tiny parasite. Men and women can give it to each other through penis to vaginal contact. Women can give it to each other by vaginal areas touching. Only about 30% of people with trichomoniasis have symptoms including itching, burning, or sore, or in a source of the genitals. You might also get a smelly, clear white, yellowish, or greenish discharge. Trichomoniasis is treated with antibiotics as well. It is important to get retested within 3 months of the treatment, even if your partner has been treated. HIV. HIV is one of, as most people know, one of the STDs that has affected the LGBTQ plus community the most. Men who have sex with men account for a humongous number of the cases that are here today. HIV is treated through oral medications. It is uncurable, but it is a manageable condition. Let me give you some facts on HIV. HIV is the virus that causes AIDS. It's passed through bodily fluids such as blood, semen, vaginal fluids, and breast milk. You can get it by having vaginal or anal intercourse with an infected person without a condom, or by sharing needles with someone who is infected. You can't get HIV from saliva or by kissing. Symptoms of HIV infections are vague. They can come like a flu with muscle aches, fatigue, or a slight fever. You can also lose weight or have diarrhea. The only way for you to actually know if you have been infected is to get your saliva or blood tested. HIV can take years to destroy your immune system, past a certain point where your body loses the ability to fight off infection. There is no cure for HIV again, but there are drugs that can help you live a long, healthy life with this virus. U equals U is real, undetectable, it's untransmittable. People that are HIV positive, take care of yourself, take your medication, see your doctors, eat healthy, and just live. It is a manageable condition, and it is not something to be frowned upon. Love your community for who they are, not their status. But before we go, we want to give you a few reminders about the COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illnesses. Variants are soaring across the United States at the moment, and it is totally understandable why you might want to continue to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks are actually vaccinated. Keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine. Everyone 16 and up are eligible to receive a COVID-19 vaccine. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, for DC residents, you can find information on COVID-19 vaccine walk-up locations, the eligibility at vaccinate.dc.gov, or by calling 1-855-363-0333. Track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov don't wait. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal. If you live in Montgomery County, or visit their vaccination registration portal or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, and social distancing. It is very important that you get vaccinated, discuss COVID precautionary measures with those around you. Be mindful of masks and keeping your distance, especially when you do not know whether a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and checking our website at whitman-walker.org for the most up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439. Follow some of our programs at WWH Family and at Real Talk DC _ and at No Filter DC. Everybody have a great day. Happy Tuesday. Again, it is STI Awareness Month. So do something positive with that.